There are times when you have to switch pump to insulin injection. For example, the pump is malfunctioning, or you may have a surgery tomorrow and the hospital does not allow you to use pump during the surgery. Then after the pump is suspended, how much insulin should you inject? In order to understand the following information, you need to make sure that you understand these concepts first. What is long-acting insulin? What is short-acting insulin? What is sliding scale? I've made separate videos to explain these concepts. Now let's look at an example. This guy has an insulin pump that is not working right, so he decides to suspend it and switch to injection. According to the pump setting, his basal rate is 1 unit per hour. That means the pump gives him 1 unit of insulin every 1 hour. That is 24 units of insulin for 24 hours. The carb ratio is 1 to 10. That means he needs to take 1 unit of insulin for every 10 grams of carbohydrates. Sensitivity factor is 50. It means he needs to take 1 additional unit of insulin for every 50 points of blood sugar above 150. Now he has some insulin pens as backup. His long-acting insulin pen is Lantus, and his short-acting insulin pen is Novolog. If you have Basaglar, Tresiba, Toujeo instead of Lantus, or if you have Humalog, Apidra, Fiasp instead of Novolog, the calculation will be the same. Since he needs 24 units of insulin for 24 hours according to the basal rate, he should take 24 units of long-acting insulin every 24 hours. In his case, it will be 24 units of Lantus every 24 hours. And the first dose should be given as soon as the pump is suspended. Carb ratio will stay the same. He will need to take 1 unit of Novolog for every 10 grams of carb. For example, if he's going to eat 50 grams of carb, then he should take 5 units of Novolog before the meal. Since sensitivity factor is 50, he will need to take an additional 1 unit of short-acting insulin for every 50 points of blood sugar above 150. For example, if his blood sugar is between 150 to 200, he will need to take 1 unit of Novolog. If blood sugar is between 200 to 250, he will need to take 2 units of Novolog. If blood sugar is between 250 to 300, he will need to take 3 units of Novolog, and so on. One important thing, you should wait at least 4 hours before taking another injection of short-acting insulin. Otherwise, 2 doses of short-acting insulin will stack up and blood sugar will become too low. Now let's look at another example. The pump setting is the same as the first example, but he will have surgery tomorrow morning, so he will need to fast overnight, and the hospital does not allow him to use insulin pump during the surgery. Since he will not eat for the next day, he should take less long-acting insulin. Normally, it should be about 70% of your normal basal insulin. Since he was getting 24 units of basal insulin a day, and 70% of 24 units is about 17 units. So he will take 17 units of Lantus before sleep and suspend insulin pump at the same time. There is no need for carb ratio since he will not eat the next day. Since the sensitivity factor is 50, he will take 1 additional unit of Novolog for every 50 points of blood sugar above 150. Another important question is, when should he restart insulin pump? Suppose the surgery is successful and he's able to eat right after the surgery. He should restart insulin pump at 24 hours after the last dose of long-acting insulin. In his case, 24 hours after the last dose of Lantus. This is because long-acting insulin lasts about 24 hours. If you start the pump too early, there will still be some long-acting insulin in the body, and you can get hypoglycemia. If you start the pump too late, there will be no insulin in your body for hours, and the blood sugar will jump up.